Medicaid expansion is set to go into effect in South Dakota on the 1st of July, covering up to an additional 42,000 eligible people. But there's one problem facing current recipients: a potential gap in coverage between pandemic-era Medicaid coverage. State House reporter Austin Goss gives us a look at what to expect moving forward from our Pure Newsroom.
If you've recently had health insurance through Medicaid, you'll want to check your current eligibility as soon as possible. That's because COVID-era regulations around Medicaid have come to an end, meaning that many South Dakotans will no longer be eligible for Medicaid, at least temporarily. South Dakota began clearing out its Medicaid rolls in April, something they were previously not allowed to do due to federal protections. According to a report by South Dakota Searchlight, roughly 22,000 South Dakotans could be on the outside looking in, or likely ineligible as the protections expire.
There's a lot of people out there who, were eligible for the Medicaid program due to the pandemic. They rely on routine medications, routine treatments for their health, and lapses in healthcare can quite frankly have devastating consequences.
And while those protections ended nationwide, South Dakota's position is even more unique because of the passage of Medicaid expansion. It means that a number of those who lose coverage could be eligible to regain it come July 1st, when the Medicaid program goes into effect.
We know that people that have health care coverage have better access to primary care. They have better access to health care so that small problems don't become big problems. And so we want people to have that continuous coverage so they can keep going to the doctor and stay healthy.
The state's Department of Social Services, tasked with implementation, budgeted nearly $600 million over the next 2 years to help cover the cost of the program, and additionally is aiming to hire 68 new staff members. It's expected that around half of those losing coverage prior to July 1st would be eligible to regain it then.
There's options with what's called the federal marketplace. That's a place where you can find a health care plan that could meet your needs, and then there's tax help to help pay for those plans depending on your income. So we think that's going to be a great option for folks. Avera does have a plan that's on the marketplace, and there's others as well.
In Pierre, Austin Goss, Dakota News Now.
As she mentioned, the state does have a website with more information on healthcare options called getcoveredsouthdakota.org. We also have a link with this story at dakotanewsnow.com.